the first of these tumors we looked at was pancreatic because it's one of the worst cancers to have. Most people live only about 4 months with surgery, plus chemotherapy, plus radiation. It only extends their life about 1 to 2 months. With the peptide hormone, the 4 of them that come out of the same gene, all 4 have effect on cancer cells, and they inhibit up to 80% of pancreatic cancers. I should say not inhibit, but actually make them completely go away. The cancers, the human cancers in the mice go away, and they never come back in the normal lifespan of the mice. So these mice live their normal lifespan of 1.5 years. Their faces get all wrinkled, and they die of old age, and then at autopsy we see that there's no cancer there. Occasionally, we don't cure every one of these animals, so we cure 80%. Of the other 20%, we reduce the size of the tumors down to less than 10% in all animals. And with Vesely MD, one of the better ones of these, down to less than 2%. So we've turned human pancreatic cancer in these animals into a chronic disease. They're not dying of the cancer, even the ones that don't have the cancer eliminated. So if they have a metastatic lesion then in these of the human pancreatic, it's where the cancer is spread somewhere else, because it never comes back where we treated the primary site. Then we use a different one of these peptide hormones from the heart, and we make the metastatic lesion go away. So not only do we get the original cancer, but if the cancer had moved somewhere else, to the liver or somewhere else, or any place actually, because these hormones circulate in your body normally. So we're just giving back 1,000-fold more than your own body can make. Otherwise, the simple way of thinking is there shouldn't be very much cancer, because these work on all cancers, not just one. And so I mentioned my wife died of breast cancer, so the next cancer we looked at was breast cancer, human breast cancers in these mice. And 2/3 of all human breast cancers are eliminated without any surgery. So they're completely gone, and then they don't ever come back. And we follow them the whole life of the animals, so to make sure they never come back. And that's the same thing with the pancreatic, which is an important point. They live a normal life. These tumors aren't coming back. The most recent one we've been working on is small cell of the lung. Small cell of the lung usually spreads early throughout the body, so when the doctor sees small cell of the lung, they almost never do surgery, in the United States anyway, for small cell. Other lung cancers they do. They start treating with chemotherapy, and some people respond very well to the chemotherapy. We eliminate about 86% of human small cells of the lung growing in mice. And the way these studies are sort of done is we put 1 million human cancer cells on the back of the mice. In about 3 weeks to a month, they form a well-rounded tumor. And after they form a well-rounded tumor, the people in the lab measure daily by digital the volume of these tumors, so we can see how they grow. The pancreatic, the reason people don't live very long with it is a very bad cancer, is 20-fold bigger in a week. 300-fold bigger, the ones we're treating, 300-fold bigger in a month, 1,300-fold bigger in 2 months, the cancer. And we make them completely go away. But they grow that fast. It's a real bad cancer. And then the other bad thing about pancreatic is because the nerves are in the capsule around the tumor. So if it's growing inside the pancreas, people don't know that there's anything there, that there's nothing to bother them. It's only when it starts to stretch the capsules when they start to feel it. So even if the tumor is huge, and we've had tumors with a small cell of the lung be as big as 1/4 of the size of the animal, and it completely made it go away. In that case, we use one hormone, and we treat for 4 weeks, and it's just treated under the skin. They have a little pump that pumps the peptides for a month, for a week, and then we replace it with a new little pump. And we sort of foresee that's the way of treating cancer in the humans later, that they might wear a small little pump like an insulin pump and pump the peptides, and they'd be treated at home. They wouldn't have to be in the hospital. So, and we're hoping that it'll help, of course, millions of people, since it's all tumors. We have adenocarcinoma. A number of these cancers are adenocarcinomas. We make colon, 97% of colon cancer go away, 97% of pancreatic, prostate cancer, small cell of the lung, squamous cell of the lung, glioblastomas of the brain, like Senator Kennedy has, we were looking at the tumors that are harder to treat.